Good evening, class. Our presentation today covers interesting facts pertaining to Medicaid and how it fits into the healthcare system. My name is Jared Kendell, along with my wonderful team member, Rylee Thueson. We will cover the process, how it works, how to apply enrollment, and qualifications needed. The scenario that was given goes like this. You have no way to pay for your medical care. You have heard that Medicaid may be the solution. Determine who to contact and where you go to apply for Medicaid. Medicaid is a federal and state program that helps low-income individuals and families pay for the cost associated with long-term medical and custodial care, provided they qualify. Largely funded by the federal government, Medicaid is administered by each state, and programs may vary. It also provides health coverage to millions of Americans today, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by states according to federal requirements. The program is funded jointly by states and the federal government. If you've heard of Medicaid, you've probably heard of CHIP. Medicaid and CHIP go hand in hand, working together to keep our kids covered. What is CHIP Medicaid? Well, in short, CHIP means Children's Health Insurance Program. It provides health coverage to eligible children through both Medicaid and separate CHIP programs. CHIP is administered by states according to federal requirements. The program is funded jointly by states and the federal government. Medicaid and CHIP both play a critical role in ensuring that children of dependent families have sufficient health coverage. Together, the two programs provide health care coverage to 1 in 3 children. Although they are both federal programs largely implemented through the states, with joint financing, the two programs differ in many respects. CHIP was created as part of the Balanced Budget Act of 1997 to build on Medicaid coverage for low-income children. States are able to utilize federal funds for CHIP to expand their Medicaid program or create a standalone program or a combination of both. The primary goal of CHIP is to expand the reach of government-funded healthcare coverage to more low-income children. As part of CHIP, the states have simplified the enrollment process, making it easier for children to obtain coverage. Although CHIP covers more children, its coverage options are more limited than Medicaid. The federal government matches state spending for both Medicaid and CHIP. To encourage more participation by states, the CHIP match rate is higher than the Medicaid match rate. On average, states receive 57% in matching funds for Medicaid spending, but they receive 70% for CHIP spending. However, under Medicaid, there are no preset limits or caps for federal matching funds. Under CHIP, funds are capped and states are limited to their specific allotment of funds. Enrollment. There are 2 distinct enrollment periods for health insurance, the enrollment period and the special enrollment period. Understanding the difference between the two is important, knowing which plans you can qualify for and when. The open enrollment period is the best time you can enroll in a government plan. These are the plans created by the Affordable Care Act. You cannot be denied acceptance to a government plan for pre-existing medical conditions. These plans also offer subsidiaries or discounts to your premium and costs, but only if you meet certain income requirements. For 2020 plans, the open enrollment period is from November 1st, 2019 to December 15th, 2019. You must enroll by the 15th of the current enrollment month for your coverage to start on the 1st of the upcoming month. For example, you need to enroll by December 15th, 2019 for your coverage to start January 1st, 2020. The special enrollment period basically begins after the open enrollment period ends. It is the time period outside of open enrollment. During this time, the only way to get a government plan is if you have certain life changes known as qualifying life events. If you miss open enrollment and do not have a qualifying life event, you could still get coverage through a non-government plan. These plans are a great and often inexpensive way to provide you with short-term coverage, specifically until the open enrollment period. How to apply. There are a few different ways. The first would be to go online where you fill out the application and then submit it. Second would be the mail-in method. This is where you would print the application and mail to the Medicaid office. The last method is a simple phone call to have someone assist you over the phone. When I was given the task to find out more information on how to enroll, I found it easiest to go to their website, www.healthcare.gov. Here are some screenshots of what I went through when enrolling. Essentially, you have to create an account. As you begin to create an account by providing a valid email address, it only takes a few seconds. You then need to answer a bunch of security questions going back to your emails inbox to obtain a password and authentication code. After your password, your Medicaid becomes active. You are ready to fill out the questionnaire enrolling for Medicaid.
There are a few terms that come up through the application process and on the Medicaid website that we felt the need to mention. Many of you may already know the definitions of these words, but here's a little refresher for everyone. CMS stands for Centers for Medicare and Medicaid Services. It is a federal agency within the United States Department of Health and Human Services that administers the Medicare program and works in partnership with state governments to administer Medicaid, the state children's health insurance program, and health insurance portability standards. Then we have eligibility, which is fitness or suitability to be chosen, selected, or allowed to do something as defined by Webster. In Medicaid, there is financial eligibility, being below the federal poverty line, and non-financial eligibility, which includes age, pregnancy, resident in state you're applying to, U.S. citizens, and lawful residents of the U.S. Next is benefits. The healthcare items or services covered under a health insurance plan is the definition of benefits. Covered benefits and excluded services are defined in the health insurance plan's coverage documents. In Medicaid or CHIP, covered benefits and excluded services are defined in state program rules. Lastly is cost sharing. It is sharing of costs covered by your insurance that you pay from your own pocket. It includes deductibles, co-insurance, co-payments, etc. Cost sharing in Medicaid and CHIP also includes premiums. As you can imagine, the qualifications you must meet in order to be eligible for the program are very strict. They don't do this to be a pain. They do it to make sure that the integrity of the program is maintained. So, you first must be at least one of the following. Be under the age of 19, be pregnant, be an adult with a child under 19, be 65 or older, or be blind or disabled in some other way according to the Social Security Administration criteria. Then, if you meet one or more of the previous criteria we mentioned, you also must meet all of the following. Be a citizen or legal immigrant to the United States, as well as be a resident of the state you are applying to receive Medicaid through. You then must verify that your income is less than the program limit according to your household size. For example, if you are a pregnant woman applying for Medicaid and you are from a two-person household, you cannot make more than $1,944 a month. If you are applying to Medicaid to get coverage for your child who is under the age of 19 and have a five-person household, you cannot make more than $4,777 a month. Finally, any resources you may have access to cannot exceed the limits set by the program. After going through the application process and dissecting the many different qualifications, we have both determined whether or not we would personally qualify for the program. Being as my husband and I are currently both full-time students, I would qualify for Medicaid assistance at this time. In fact, I am currently enrolled in the program along with our daughter. Jared, on the other hand, is a full-time employee and a part-time student, and he would not qualify for Medicaid at this time because their household income exceeds the program limits. Jared and I foresee many run-ins with Medicaid throughout our careers. These programs are not few and far between. Around 75 million people are enrolled in Medicaid, so we imagine it would be hard to work in the healthcare industry without frequent encounters with it, especially because many healthcare facilities around the nation accept CHIP and Medicaid insurances. We think we will be very impacted by these programs and also be able to witness any changes that may occur within them in the future. Now we'll talk about the successes and difficulties that we encountered. The application process wasn't a walk in the park, nor very fun, but it is very user-friendly and easy to follow. They provide many resources for you to reference if you come across any difficulties, the main one being their phone number. Jared and I both found success in the application process. The only thing we can think of that was a slight difficulty was the part of the application where they ask about your employment and personal finances. That portion of the application is very detailed and asks for a lot of information, and we think it would be beneficial to have a strong understanding or gathering of all of your finance information and employer's information when going into the application process. Jared preferred to do the application process via internet. He said it was easy to create an account, log in, and fill out the information needed. It was much faster than calling a landline and waiting for someone to answer the call or filling out paperwork and sending through snail mail. The website was easy to navigate and was self-explanatory, and he suggests that if you don't have the equipment, or we suggest if you don't have the equipment like a computer or printer to fill out the application or get it printed, to do the application process over the phone. If you do have the tools to complete it online or by mail-in, we would suggest doing it that way. It would be beneficial to have your finance information on hand, like we had mentioned previously, before you begin the application process. Call their number if you have any questions and know that it is worth it when you are done with the application process. I called in the Medicaid office when I was doing my research and talked to somebody about the phone version of applying, and they said that if you call in wanting to apply over the phone, they will encourage you to try and do it on your own. But if you don't have the means to or have some impairment that hinders you the ability to do so, that they are willing to help you. The process is still pretty tedious and can take quite a bit of time though, even when doing it over the phone. We have come up with a few questions for you guys to ponder going into our discussion board. Feel free to answer one or all of them, and please share any other thoughts, knowledge, or experiences that you feel prompted to. We look forward to discussing Medicaid and CHIP in greater detail with all of you throughout the week.